Well, this is the reason why this kind of transparent reporting is going to be so important. There is a way for us to look at death certificates and also to look at the medical records of individuals prior to their death. And I think this needs to be separated into three categories. One is the COVID as a direct contributor, the primary cause of death. The second is, could it be a secondary contributing cause? So, for example, somebody with kidney disease, COVID then pushes them over the edge to have kidney failure. That's COVID as a contributing cause. And then the third is COVID as an incidental finding. So somebody coming in with a gunshot wound or a heart attack and they happen to test positive. I think that we need to separate out and look at the percentages of each. That percentage would have shifted over time as well. In the beginning, probably a lot more people were dying with the primary cause of COVID. That probably has shifted. And I think, again, we need to understand this. Another reason to understand this, too, is a lot of people are wondering when they should get a booster next. When do we need a second booster or another booster? And the only way we can know for sure is to understand who is getting severely ill and when.
That was CNN medical analyst Dr. Leana Wen, based Leana Wen, as I call her, singing a very different tune than you might remember. Dr. Wen, who's also a columnist for the Washington Post, recently wrote an op-ed for the paper hammering the point that the number of deaths reported as being caused by COVID far exceed the amount of people who are actually dying as a result of COVID infection. Despite her 180, Wen previously was a staunch supporter of most, if not all, of the COVID rules, mandates, and restrictions, and she changed her mind later. So her abrupt about face is not being received well by some in the COVID skeptic community, and then also some who were in her community previously. She almost pleases no one by switching, although she's pleased me for saying things that now I think aren't. Look, I didn't agree with her, and now I do agree with her. So what do you want me to say?
I saw you tweeting, "This is based on a win," and I saw some of your followers
You're like, no, I can't.
Absolutely not. It would have been based 2 years ago. This is what's confusing me about this story. Mm-hmm. This seems like kind of obvious that there are some people who have COVID who are hospitalized for other reasons, and there's some people who are hospitalized because they have COVID. And to me, the presumption for me when all of these numbers are being reported is that everyone understands that to be the case, and that when they're reporting COVID deaths, they should be reporting deaths from COVID. So the scandal, it seems to me, it's not that anyone is denying the possibility that there were many people who would be hospitalized with COVID but not die from COVID or hospitalized because of COVID, but that apparently there was no disaggregation when all of these newspapers were reporting on this before. I think a lot of folks would find that fact to be shocking because there was, at least if I think about my own perspective, there wasn't like a desire to misrepresent COVID deaths. I would want to know who actually died from COVID to know how dangerous the disease was.
For 2 years, people in what we're calling the contrarian or the skeptic community would say exactly what Leana Wen is saying there, and say, well, even if it's not all these deaths are directly attributable to COVID itself, and you were kind of mocked for doing that, or you were said, like, does it really matter? I remember hearing a lot of that. Like, you're trying to quibble and know exactly what, there's no way to tell exactly what killed you, even though in some of these cases you could tell. If it was a car crash, it was a gunshot, and they just happened to have COVID. So I had an elderly relative go to the hospital a couple months ago, and then while he was in the hospital, he tested positive for COVID. It had nothing to do with why he was there.
Yeah, well, especially now that people are vaccinated and the likelihood of dying from COVID are much lower, I can understand why, it doesn't seem as, I don't know, it's not that it's not as significant, but it's not as pressing as it was in the early days.
The 400 a day number is really scary to people, because that's a lot of people. But we don't want people to get the wrongful impression that you could, if you just catch it, you could be one of those 400 people.
Well, that's what I'm asking. So in the Washington Post article, Leana Wen's article, it's also not clear to me. So the idea of there being a gap between what was reported and who was actually dying from COVID, fine. But what do we actually know about how big that gap was and how much the overcounting was? Because that seems to me to be a really crucial part of the story.
So
she includes a chart that is from July 2022 to July 2023, in which only about 10% of it shows Massachusetts tracking how many people were hospitalized from COVID versus hospitalized for COVID. And it's only about 30% of total hospitalizations with COVID were primarily attributed to the virus. But that's not saying anything about, one, what the death ratios were and hospitalization from COVID ratios were back when people were not vaccinated and more people were dying from COVID. And that also doesn't say, much about how that relates to the numbers that we see about the risk factors of being hospitalized because of COVID overall.
So in her article, she goes into much greater detail, and she cites Shira Doran, who is an infectious disease physician, who is trying to answer this question: how do we figure out exactly how many people have severe illness due to COVID? And what she said, if you're in the hospital for COVID, you're very likely to be prescribed a steroid, dexamethasone. I'm probably saying that wrong. I won't even try again. Anyway, so if you're given that, you're probably in the hospital for COVID itself.
Right.
And she said that
that's what this chart is about. The chart is Doran's work informed the chart where we just see for Massachusetts, but we can generalize a little bit here.
Yeah.
And that's where we get the 30%.
So she's at 30%. Yeah.
But I guess what I'm saying is.
So I don't understand what you're asking.
Okay, so this is overcounting between people who are hospitalized from COVID versus hospitalized for other things that happen to have COVID. One, this doesn't tell us about whether or not deaths from COVID are actually being overcounted, right? Like, there's no deaths from COVID on this chart. It's patients primarily hospitalized for COVID, number of hospital patients with the coronavirus. It's also for a really recent period of time where deaths from COVID are overall smaller than they were before the vaccines. And what we really want to know, I think that what would be really misleading is if during the time when we were being told that so many people were being hospitalized and dying from COVID because there were no vaccines, if during that time, in fact, very few people were actually dying of COVID, that would be really, really big news.
Sure. I don't think Leana Wen is definitely not claiming that. This article is not claiming that. What they're claiming is now, with the 400 deaths a day number, whatever it is, somewhere around there, it was that within the last couple of weeks, I think they're saying a significant chunk of those, based on the 30% number, the 90%, other variables they're coming up with to look at how many of these people are very sick from COVID itself, probably a significant majority of those people are dying for some other reason.
But how do we know that? I mean, how do we know that?
Well, that would be extrapolating from.
But I don't know that that's. Look, I have nothing against whatever the outcome is. I have no dog in this fight. But I need reporting on how the people who are coming up with today's numbers are actually coming up with today's numbers, not just a chart that compares people who have COVID versus people who are hospitalized for COVID.
Well, right now, I think it's just being counted if they had COVID.
But that's
died.
I think.
Okay.
You know what I mean? That's all I'm saying. So I would like to see some more reporting on this, because I would be, at this point, people are still counting someone who comes in with a gunshot wound who happens to test positive from COVID as a COVID death. That's obviously ridiculous, right?
Yeah.
But are people actually still doing this at this point?
Again, I think, but it sounds to me like the answer was that was always the case, but earlier on in the pandemic and for a long run, you're going to have those were going to be few and far between, given how many people actually were dying of COVID. Elderly people, immunocompromised people, no vaccines, no protection, no prior infection, all that stuff was adding up to a lot of people actually dying of COVID. Mm-hmm. That is now greatly diminished because so many people have some kind of protection, either from vaccine or prior infection or both. So now we just don't want people to think, we don't want people to be unnecessarily scared. COVID can still cause you serious disease and even death, particularly if you don't have protection or you're elderly or you're immunocompromised.
Plus there's the long COVID of it all.
Right, that's a different matter. But the idea that an otherwise extremely healthy person is so unlikely to end up in that 400 deaths category is like extremely unlikely because that 400 is, first of all, talking about a lot of people who didn't actually die of COVID, and then.
Yeah, sure. I do wish this had been, I don't know, just a little more reported, and I'm sure we'll see more of these numbers. But what does that mean? Does that mean that 380 of those people actually died of COVID? That only 200 of those people actually died of COVID? And how do those death rates compare to other kinds of illnesses that we kind of live with, like the flu? I
mean, I think what Leana Wen is suggesting is that it's more than that. It's the vast majority.
Yeah, suggesting that. Mm-hmm. I just want a little bit more firmness. I guess I also just want to ask you: are you surprised at all, given how I know that you've spoken a lot about how Leana Wen was very much on the other side of a lot of these issues with respect to COVID reporting? To what do you attribute? Is this really an about face, or are people evolving as they learn more things?
I mean, her explanation, so there was a personal component of her explanation, which it sounds like she really got fed up with. She said the virtual learning, remote learning for her young kids was a bad experience, and she thinks they are definitely behind because of it. what she also said is that once Omicron came out, it was so infectious, so able to evade all the protections we can assemble. Given that vaccines were readily available, the ability to really, really try as a society to have a lot of mitigation and crush COVID, she said it's just not realistic anymore, and that has caused a lot of her different thinking.
Well, interesting. Positive news for the people who have wanted a lot more clarity and diversity in COVID reporting and the mainstream news. I hope to see more of it, and we'll have more Rising for you after this.